Hey everyone, welcome to our channel. Today we're diving into a crucial topic that could save your life, your heart health. Our bodies often send out subtle signals long before a major event. Ignoring these signs is like hitting the snooze button on your health. We'll cover 11 strange signs that your heart might be in trouble. This video is for informational purposes only. It's not a substitute for seeing a medical professional. Grab a glass of water, make sure you're comfy, and let's get started. Calf swelling or pain could be more than just soreness. Persistent swelling, especially in one leg, might indicate deep vein thrombosis or DVT. DVT is a blood clot in a deep vein, often in the legs. It can be dangerous if it travels to the lungs, causing a pulmonary embolism. If you notice sudden swelling, call your doctor immediately. Now, I don't want to scare anyone, but DVT is serious business. The good news is, if caught early, it's treatable. Your doctor can assess your symptoms, possibly order an ultrasound to confirm the diagnosis, and if needed, prescribe blood thinners to prevent the clot from getting bigger and to help your body naturally dissolve it. But the key here is early detection. Ignoring leg pain or swelling, especially if it's unexplained or accompanied by other symptoms like shortness of breath or chest pain, is like playing a dangerous game with your health. Remember, you know your body best. If something feels off, don't hesitate to seek medical attention. It's always better to err on the side of caution when it comes to your heart. Up next, we're tackling a sign that often gets overlooked but can be a surprising indicator of heart trouble: bleeding gums. That's right, your oral health is intricately connected to your heart health. Stay tuned to find out why. Bleeding gums might seem unrelated to your heart, but there's a strong connection. Gum disease caused by plaque buildup can lead to heart disease. Inflammation from gum disease can damage blood vessels, increasing heart attack risk. Don't ignore red, swollen, or bleeding gums. Now, the good news is that maintaining good oral hygiene can go a long way in preventing gum disease and protecting your heart. Brushing your teeth twice a day, flossing daily, and using an antiseptic mouthwash can make a world of difference. And don't forget about those regular dental checkups. Your dentist can spot the early signs of gum disease and provide appropriate treatment, which might include a deep cleaning or even medication in more severe cases. Remember, taking care of your oral health is about more than just a bright smile. It's an investment in your overall well-being, including your heart health. So, make those dental appointments and brush and floss like you mean it. Coming up next, we're diving into a sleep disorder that many people don't even realize they have, but that can wreak havoc on your heart: sleep apnea. Stay tuned to learn more about this silent threat and how to recognize its signs. We all know a good night's sleep is essential, but did you know it directly impacts your heart health? Sleep apnea, a common sleep disorder, can wreak havoc on your heart if left untreated. Essentially, sleep apnea occurs when your breathing repeatedly stops and starts throughout the night. This disrupts your sleep cycle and puts extra stress on your cardiovascular system. Imagine your heart as an engine, constantly working to pump blood throughout your body. Now, imagine that engine being jolted awake every few minutes. That's what sleep apnea does to your heart. Over time, this added strain increases your risk of irregular heartbeats, high blood pressure, stroke, and even heart failure. So how do you know if you have sleep apnea? Well, the telltale sign is loud, chronic snoring, often punctuated by gasping or choking sounds. But it's not just about the noise. Do you wake up feeling exhausted even after a full night's sleep? Do you experience morning headaches, difficulty concentrating, or irritability during the day? These are all potential red flags for sleep apnea. Remember, your sleep shouldn't feel like a battle. If it does, it's time to see a doctor and get checked out. Early diagnosis and treatment are crucial in preventing serious complications down the line. Don't ignore the signs. Prioritize your sleep and your heart health. Have you ever experienced a sudden wave of weakness, especially on one side of your body? This could be a sign of a stroke, a life-threatening condition requiring immediate medical attention. A stroke occurs when blood flow to the brain is interrupted, often due to a blood clot. This can lead to brain damage, affecting movement, speech, and other vital functions. Time is of the essence when it comes to strokes. Remember the acronym FAST. Face drooping, arm weakness, speech difficulty, and time to call 911. If you or someone around you exhibits any of these signs, don't hesitate. Call emergency services immediately. Every minute counts in minimizing potential brain damage. Sudden weakness can also signify a heart attack, another critical medical emergency requiring immediate action. While chest pain is a common heart attack symptom, some people, especially women, may experience less typical signs like sudden weakness, nausea, and shortness of breath. Don't dismiss sudden weakness as something minor, especially if accompanied by other symptoms like chest discomfort, jaw pain, back pain, or shortness of breath. Remember, it's always best to err on caution when it comes to your heart health. If something feels off, don't hesitate to seek medical help. Your quick thinking could be life-saving. We often associate skin rashes with allergies or skin conditions, but did you know they can sometimes signal underlying heart problems? Our skin, the largest organ in our body, can reflect what's happening internally, including our cardiovascular system. Specific rashes, especially around your fingers or toes, can indicate inflammation of the blood vessels, a condition linked to heart disease. Now don't panic if you have a rash. Most are harmless and easily treatable. However, if you notice unusual rashes, especially if they persist or are accompanied by other symptoms, it's essential to consult a healthcare professional. One example is Janeway lesions, painless red or purple spots on the palms or soles which can indicate endocarditis, an infection of the heart valves. Another is Osler's nodes, painful red bumps found on the fingers, toes, or feet, often associated with infective endocarditis. Remember, these are just a few examples, and a proper diagnosis can only be made by a qualified healthcare professional. So, pay attention to your skin. It can provide valuable insights into your overall health, including your heart. If you notice any unusual changes, don't hesitate to seek medical advice. Hey everyone! Unexplained indigestion might signal your heart needs attention. Indigestion isn't just about food, it can be heart-related. Persistent heartburn, especially if new, can indicate heart issues. Your heart and stomach are closer than you think. Frequent indigestion with nausea or sweating? See a doctor. Better safe than sorry, guys. Listen to your body and consult your doctor if something feels off. Unexplained indigestion means heartburn you can't easily explain. If it's frequent without obvious triggers, pay attention, especially with symptoms like nausea, vomiting, or pain radiating to your jaw or arm. These are red flags for something serious. Most indigestion is harmless, but always consult your doctor. Early detection is key for heart health. Your heart will thank you. Sign number 7 that your heart might need a checkup: a chronic cough. A cough is usually just your body's way of clearing your airways, but a persistent cough could be a sign of heart failure. Fluid buildup in your lungs can trigger a chronic cough. If you have a persistent cough, see your doctor. The goal isn't to make you anxious about every cough. It's about recognizing potential warning signs and taking action. Your body sends out subtle signals when something isn't right. A chronic cough that lingers for weeks shouldn't be ignored, especially if you have risk factors like high blood pressure or diabetes. Pay attention to your body and note any other symptoms. Are you also feeling short of breath? Experiencing fatigue or swelling in your legs? These could be signs of heart failure. Seek medical attention. Early detection is key for heart health. Don't wait until symptoms become severe. Listen to your body and reach out to your doctor if you have concerns. Fainting spells, also known as syncope, can be a sign of a serious heart condition. When your heart isn't pumping blood effectively, your brain might not get enough oxygen. This can cause a sudden drop in blood pressure, leading to fainting. Seek medical attention to determine the cause and ensure heart health. Now, I know what you're thinking. Dr. Mike, I fainted once after giving blood. Does that mean my heart is about to explode? And the answer is probably not. A single fainting episode isn't usually a cause for major concern. However, recurrent fainting spells warrant further investigation. Pay attention to the circumstances surrounding your fainting episodes. Did you feel dizzy or lightheaded beforehand? Were you exercising or standing for a long period? Did you experience any chest pain, palpitations, or shortness of breath? These details can provide valuable clues for your doctor. If you experience any of these symptoms, see your doctor as soon as possible. Remember, your heart health is paramount. Don't hesitate to seek medical attention if you're experiencing any unusual or concerning symptoms. Early detection and intervention can make a world of difference. All right, guys, let's talk about sweat. We all do it. It's natural, it's healthy, but sometimes excessive sweating can be a sign that something's off with your heart. If you're sweating excessively without exertion, it could be a heart issue, especially if accompanied by chest pain or shortness of breath. Seek medical help. Now, I know some people naturally sweat more than others. We're all built differently, and that's okay. But if you notice a sudden change in your sweating patterns, like you're sweating more than usual or at odd times, that's definitely a red flag. Pay attention to your body and what's normal for you. If something feels off, don't hesitate to bring it up with your doctor. It's always better to be safe than sorry, right? Early detection is key when it comes to heart health. And remember, I'm not trying to scare you guys with this information. Knowledge is power, and the more you know about your body and the potential warning signs, the better equipped you'll be to take action and protect your health. So stay informed, stay hydrated, and if you're ever in doubt, don't hesitate to reach out to a healthcare professional. Take care of your heart. It's the engine that keeps you going. Hey everyone, Dr. Mike here. Anxiety isn't just a mental health issue, it impacts your heart too. Chronic anxiety floods your body with stress hormones, straining your heart. This increases your risk of high blood pressure and heart disease. Address anxiety for both mental and heart health. Your heart will thank you. Now, I'm not saying that every time you feel anxious, it means you're having a heart attack. But if you're experiencing prolonged periods of anxiety, especially if it's accompanied by other symptoms like chest pain, shortness of breath, or dizziness, it's crucial to get checked out by a doctor. Remember, early detection is key when it comes to heart health. The sooner you address any potential issues, the better your chances of preventing serious complications down the line. So don't brush off anxiety as just in your head. It's a real condition with real consequences for your physical health. And hey, even if you don't have chronic anxiety, taking steps to manage stress and prioritize your mental health is always a good idea. Make time for activities you enjoy, connect with loved ones, and don't be afraid to seek professional help if you need it. Your heart and your mind will thank you. Now let's move on to our final sign. We're talking about the subtle signs your heart might be asking for help during workouts. If you're consistently noticing a decreased tolerance for exercise, it's worth paying attention to. This could be a sign that your heart isn't pumping as efficiently as it should be. Always better to err on the side of caution and get checked out by a doctor. Remember, your body has a way of communicating with you. And sometimes those whispers can be easy to miss. Don't ignore what your body is telling you. If you're noticing a significant change in your ability to exercise, don't brush it off as getting older or being out of shape. Schedule an appointment with your doctor to discuss your concerns. They can perform a physical exam, review your medical history, and order tests if necessary to determine the underlying cause of your decreased exercise tolerance. Early detection and treatment are crucial when it comes to heart health. By paying attention to your body's signals and seeking medical advice when needed, you're taking proactive steps to protect your heart and your overall well-being. And remember, even if you're not experiencing any symptoms, maintaining a heart-healthy lifestyle is essential. That means eating a balanced diet, exercising regularly, managing stress, and getting enough sleep. That's it for today's video on the 11 alarming signs your heart needs help. Remember, your heart works tirelessly to keep you going, so it's crucial to listen to its signals and take care of it. If you notice any of the signs we discussed, don't hesitate to reach out to a healthcare professional. Early detection and treatment are key to a long and healthy life. Thanks for watching. If you found this video helpful, make sure to like, comment, and subscribe for more health tips. And remember, always listen to your body and consult a healthcare professional if you notice any of these signs. Stay healthy, everyone!